Thank you. My name's Diane Rohlman. I'm at the University of Iowa, though I was out in Portland for many years. I was at OHSU, Oregon Health and Science University, and that's where I first got involved with pesticide work. So I'm familiar with some of the crops that are grown out there and the workers that are involved in that, and now I'm building up my skills here in the Midwest. But I wanted to start off with this picture. In 1998, this picture was on the cover of Environmental Health Perspectives. And it's a picture from a study that was done by Buzzy or Elizabeth Gillette. And she was an anthropologist, and she went to Mexico and looked at preschool children and their pesticide exposure. So she had two groups of children, one living in the foothills and one living in the valley, complete a number of different tasks. She had them drop raisins into a jar to look at fine motor skills. She tossed them a ball to see if they could catch it at 1 meter, 2 meters, and 3 meters. She asked about their memory by saying, at the beginning, you would get a red balloon if you completed all of these. And at the end, she'd say, what was the prize you would get? So these are not standardized tests, they're anthropological tests, but they provide some important information. One test she did use is this one. It's called a draw a person test. And so she gave the kids a piece of paper and a pencil, and she asked them to draw a person. And the test is scored based on the number of features that children include in the drawing. Do they include eyes, nose, mouths, fingers, toes? Or are they more rudimentary drawings? And if you look at this, it's a very clear difference between the two groups of children. The one in the foothills included a lot more features in their drawings than the ones in the valley. And they're the same age, between 4 and 6 years old. And what she realized is the ones in the foothills, their parents tended to work in the cattle industry, so they raised livestock. And the ones in the valley tended to grow vegetables. And with vegetables, you tend to apply more pesticides. So this was kind of the beginning of the concern about pesticide exposure among children and having neurodevelopmental effects. So just to give you a little bit of history, I'm talking about one class of insecticides, organophosphate pesticides. And there's a short list of some of them there that you might have heard of or might be applied in your area: malathion, parathion, diazinon. And the one at the end, Chlorpyrifos, is one that's been in the news a lot lately. And I'll let you do a little homework to see why it is. But these are chemicals that were developed during World War II. And at this time, they realized that they were pretty potent. They're neurotoxicants, so they're designed to attack the nervous system. And they branched off after World War II, and those that were less toxic to mammals became agricultural pesticides, and those that were highly toxic to humans went on to become nerve agents. So when we hear about nerve agent attacks in Syria now, they're using things that are organophosphorus chemicals. In 1970s, they started to be really widely used in agriculture around the world. And during this time is after Rachel Carson's book came out, where we realized that organochlorines, things like DDT, were sticking around in the environment and having an adverse impact on our wildlife and features there. So we needed to get rid of those and replace them with something else. And the organophosphates are what they were replacing them with. So at this point, we also started to see that agricultural workers who could apply organochlorines without having adverse health effects started to become acutely ill when they worked with these chemicals. So they were much more toxic at smaller doses. And then in 1996, the Food Quality Protection Act became concerned about pesticide residues in food, and they asked for a review of different classes of pesticides, and they started with the organophosphates. And their concern really was kind of what the slide before I showed, is the impact on neurodevelopment. So organophosphate pesticides and carbamate pesticides are what we call cholinesterase inhibitors. So they block the function of cholinesterase, which increases the levels of acetylcholine, the neurotransmitter in your nerve, and it has an impact on the transmission of nerve impulses and also brain growth and development. And when we look at the symptoms, you'll see that what these result in: a lot of seizures, a lot of other things that are associated with nerve transmission. So how are people exposed? And when we think about this, we often focus on agricultural workers. And if you look at the pictures here, People can be exposed when they're mixing and applying pesticides, getting ready to apply them. The picture in the bottom shows different types of application. One is a guy standing in a field spraying pesticides. The one in the middle is an air blast sprayer. The one in the top right is something we might see here in the Midwest or in other areas, a big sprayer. So certainly application is an area, but people are also exposed when they're working with plants that have been treated with pesticides. So going into wet foliage is an area where we see a lot of exposure. And then in Iowa, we still have these crop dusters, which makes a concern about pesticide drift as they spray the fields. So agricultural workers are exposed, but other people living in rural communities are also exposed, and they may be exposed from the food they're eating or the water they're drinking. The image at the top of the screen here is a mosquito coil, which is residential use of pesticides or spraying for bugs in the house. You may live in a house that's next to a field or an area orchard which is being sprayed with pesticides. Or parents may bring it home from work, carrying it on their shoes or their clothes that gets into the house and kids come in contact with it. And it's also in the environment if you're living in a rural area. So when we think about pesticide exposure, we want to focus on workers who we have the higher exposures, but remember that people living in the communities also can be exposed. So the symptoms of pesticide exposure depend on your level of exposure. If you have mild symptoms, probably you're still walking and talking. You may have a headache or dizziness, have an upset stomach. You may start sweating or salivating, again, because of your nerve transmissions there. As your exposure increases, you're going to start to see more severe symptoms. You may not be able to walk. You may speak in a soft voice. You might start having muscle twitches, or your pupils will be smaller. And at very high levels of exposures, you can be unconscious and have a whole bunch of other symptoms, and ultimately you could die depending on how high your exposure is. And when we think about these symptoms, some of them are pretty nonspecific at those low levels, so it may be hard to diagnose somebody with this. But there is a blood test for organophosphate pesticides that can be done, and that can be done by measuring the plasma, butyrylcholinesterase, or the red blood cell acetylcholinesterase. And so that's, unlike a lot of pesticides, that is something unique about the organophosphates. So cholinesterase monitoring programs can be put into place to protect workers. And they're designed for workers who handle these toxic category 1 or 2 organophosphate or carbamate cholinesterase inhibiting pesticides. And the benefits of these programs is they're trying to prevent overexposure to these pesticides before the illness occurs. So it's like a screening program. But it also can increase the employer or worker awareness of the hazards of pesticides and reinforce appropriate work practices. And as good as these programs are, only 2 states have these programs, California and Washington State. So what does the program look like? Well, because there's individual variability with cholinesterase levels, what we want to have is a baseline, a pre-exposure baseline for the workers. So after a period where they've not applied pesticides and before they begin the pesticide application season, so they're usually applied in April, May through the summer. So maybe in March, you would take a blood sample when somebody hasn't handled those, and that would be an individual's baseline measure. You would then monitor them for the next 30 days. And if you apply pesticide for 6 out of those 30 days, you need to go in for another blood test. If the blood test doesn't show any inhibition, then you can continue working. And this would continue throughout the cycle there. So what happens if you get the results back and you find that there's a depression from baseline? Well, if it's a mild depression, less than 20%, there's retesting of the employee, but it's also a responsibility for the employer to evaluate work practices. So talk about, with the worker, ways to reduce exposure, giving more training on protecting yourself, looking at the fit of personal protective equipment, the maintenance of that, looking at reading labels and also understanding what the workplace policies are to reduce exposure, which I think is actually a pretty good thing. If your red blood cell cholinesterase level is below 30% or your plasma cholinesterase level is below 40%, at this point, the employee needs to be removed from the workplace for a certain period of time and then retested to make sure that their cholinesterase levels return back to normal. So again, these are great programs, but only 2 states have them in place. What you may see, though, is a worker who's been exposed, maybe from Iowa, maybe from another state, who comes into your office here, and you won't have that baseline measure, but what you will have is you can take a blood test to see what their level is, compare it to normative data, and then after 30 days, do a second blood test and see if it's increased and gone back up to what we think is their normal level. So I supplied this case study as one of the reading articles there, because it was an example that I think is something that many of you may see, particularly those of you in the West Coast there. But just to remind you, as workers were using an air blast sprayer, and here's a picture of that here, to apply pesticides to a pear orchard. It's a great device because you can drive in between the rows of trees and it sprays the pesticides. You can see that the worker here has personal protective equipment on and is actually in front of the spray, so their exposure may be limited. But next to the pear orchard was a cherry orchard, and it was owned by a different farmer. And the workers there were not applying pesticides, they were trying the branches to trellises. And the spray drifted from the pear orchard over into the cherry orchard, and the workers got sick. They got sick immediately and they went to the hospital. The 2 applicators didn't have any symptoms. They were wearing full PPE, personal protective equipment, including air purifying respirators or masks, and then chemical resistant headgear. So they didn't get sick. And the symptoms were nonspecific. They were nausea, GI trouble, and other things that you might know what they were. But I picked this case because it's an example of an off-target pesticide drift. So you want the pesticide to stay where you applied it, but in some cases it moves away. So you need to think about that when a farmer's going to apply pesticides. This also is an example that we don't usually apply just one pesticide. Usually it's a mixture of pesticides because it takes time and effort to spray it. And this makes it really hard to know which actual chemical is causing the illness or the symptoms there, or if they're interacting together, or if the inert ingredients in the pesticides are acting together. So it makes it a little bit tricky when a worker comes in who's exposed. This also included some newer pesticides. There were no information about human hazards or overexposures that could help you guide and determine what the treatment should be. And as I mentioned, the symptoms of acute illness tend to be nonspecific, and there's not a lot of diagnostic tests to assess if somebody's been exposed. You can look at urinary metabolite levels, but those will fade out pretty quickly, and only the organophosphates have a blood test to look for that cholinesterase inhibition. One of the other problems with this case was that there was no notification between the 2 farms that they were going to be applying pesticides in that adjacent field. And my focus is always on prevention. And so that's one area where you have that open communication, you can prevent these situations from happening. So if somebody comes in and they think that they might be exposed to a pesticide, maybe it's a child who's got a wet shirt and was found in the garage with an empty pesticide container, maybe it's a worker who was doing something and there was drift, maybe it's somebody who lives in a rural community and they did the air blast spraying. There's a couple of steps that it's recommended you take. First of all, get any information you can on the pesticide. Knowing what is being applied is really important. Decontamination, because you want to get that away from their skin so there's no more absorption, is important, and you may need to decontaminate your office or the emergency department. You want to collect any evidence you can of contamination. So put those clothes in a bag. If it's an area where there were toys or windowsills, try to get a wipe of those. But combine that all in there in case there's a need to try to track this down more. It's recommended you take a urine sample, even though you may not be able to assess something. If there's information on the label about what's applied, there may be a metabolite that you could look for. And if you think it might be an organophosphate pesticide, you can go ahead and take a blood sample for the cholinesterase screening. You should follow up with the patients, and then many states require that you report the pesticide incident to the State Department of Public Health. And if you do a blood sample for cholinesterase screening, remember you need to follow up with them several weeks later. So when you look at a pesticide label, you will see that there's information on it that could be really useful to you. Probably the most important one is the EPA registration number, which is right in the middle of the label there. And that is a number where you can go online, you can put that number in and get information about what the hazard is and what we need to do about it. The other thing you want to look at is the active ingredient, and that will tell you, if you know a little bit about it, it will tell you what sort of pesticides you were exposed to and whether you need to be concerned or not. Insecticides tend to be more harmful to humans than herbicides. So if somebody's spraying weeds, you're more likely to see dermal irritation and less acute symptoms. So as people, providers in rural areas, I would recommend that you know what to look for. You can do a little bit of education of yourself to know what's being applied and what crops are growing in your area. And your state extension agent is a great person to talk to about this. You know what crops are being planted in your region and what pesticides are being applied. And it's also time to think about when are they being applied. If somebody comes in February and you have, several feet of snow and says they've been exposed to pesticides, it's probably not an agricultural exposure, it's probably a residential exposure. It's also important to think about how they're applied, because some ways try to keep the pesticide where they want it to be, and other ways there's more possibility for it to drift, just like in the case example we looked at. And also ask about, how did the exposure occur and the extent of the exposure. So Chlorpyrifos, I mentioned, is one organophosphate insecticide. It's been in the news a ton. Different groups are trying to get it banned. It is banned for residential use, but it's still being used in agricultural fields. The EPA keeps flip-flopping on this, and there's course-ordered cases, so that's another talk. But for a lot of these pesticides, there are maps, and these maps show how much pesticide is applied in different areas of the country. And I find these fascinating, and part of that is because I'm in Iowa, right in the middle, and you can see we apply a lot of Chlorpyrifos in our state. Other areas you can see in the West Coast, the orchards there in the west, the eastern part of Washington, and also in the Hood River Valley, and then the Salad Bowl region in California. So if your state here has white, probably don't need to worry about Chlorpyrifos too much. The other thing you can find when you do this in the links at the bottom of the page is you can see what crops are getting this pesticide applied to them. And in Iowa, corn and soybeans are real big crops here, and we use a lot of Chlorpyrifos on those crops. Purple is the orchards. Again, we see that, and cotton is another one, but not as much. What you might notice when you look at this is that there's a decrease in the amount of Chlorpyrifos that's being applied. And that's part of the concern about the health effects associated with these organophosphates. So just like we phased out DDT in the 1970s, organophosphates are slowly starting to be phased out. So the question is, what's replacing them and what are the hazards associated with those? Those are pyrethroids and most recently the neonicotinoids, which we don't know a lot about except that they're pretty harmful to bees and the birds. So here's an example of some of the things that you might know if you were a physician in the Midwest and there were a lot of corn growing around you. So you might talk to your extension office or Iowa State, or come talk to me and we'll talk about what's happening with corn production. So in late spring is when planting is occurring. And at this time we see we're using seeds that are treated with fungicides or insecticides. And it's the neonicotinoids. And those are a picture of those pink seeds. So they color coat the seeds that you know that they're treated with pesticides. There's little occupational risk of these being exposed because it's on the treatment and you usually don't touch the seeds. But if some fall on the ground and a kid picks it up, they could ingest it because it looks like candy. Also think about how the seeds are put into the ground. Big planters are being used. So again, not much contact with the seeds that are treated with pesticides. During this time, we also spray herbicides on the crop. So there's a pre-emergent, it's typically atrazine. And then we might also spray Roundup or glyphosate if the weeds emerge. And with the corn crops, you can see the pictures on the right. Those are the big sprayers. You see that the driver is in the cab of a tractor. They're not likely to have high exposures. So your opportunities for getting exposed are limited, except when you're maybe mixing and applying them. Insecticides may be applied. This is where the organophosphates or pyrethroids are, treating for rootworm. In June and July, the crop is now up. That's when you're driving through, looking at all that corn, and usually we apply more herbicides at that time, not insecticides, so you won't likely see Chlorpyrifos being applied at this time. And then there's also a fungicide treatment that occurs between the end of June and early August. And those, again, are usually the big sprayers out there, or it may be the crop duster, airplanes, or helicopters. So this tells you what's going on, and if somebody comes in, what they're likely to be exposed to. So workers aren't the only ones exposed to pesticides. People living in the communities are also at risk. And this figure here shows the different areas and ways people are exposed. And all of these factors are linked to higher urinary metabolites for pesticides or for finding residues in home dust samples. So just living in an agricultural community increases those levels. Having homes closer to the field also increases the level. If you look at the picture on the left, this is some farm worker housing next to some orchards. And so when the orchards are applied, it can easily drift into the farm worker housing. You can also see in front of the trailer there is a mixing station where they're mixing up pesticides. And this is where people are living and children are playing. If you have more adults in the home working in agriculture, your pesticide residues in the home will increase, and that's because there's more likely it can be tracked into the home. Time of year is important. I just talked about that. The type of job you're doing. The Fensky article talked about that. If you're mixing and applying, you'll have higher exposures, but other jobs also have exposures. And if you're going into the fields after pesticides are applied, you may not get the same training somebody who's applying the pesticide gets. And then you can protect yourself by hygiene practices and using PPE. Also, having policies at home is important here. The picture on the left is a worker who they put fluorescent tracer in the pesticides and had him go about his job. And you can see where he's being exposed. So he's obviously touching his face and he's touching his hat. And those are areas where you can show that to someone and talk about, don't do that, or make sure your personal protective equipment is working. There's a lot of materials out there about residential exposure and keeping pesticides from work out of the homes. And a lot of that has to do with laundry and hygiene practices. And these materials are available in multiple languages. And the resources that I'll share also have access to a lot of these resources. Think about how your pesticides are stored. And this is both for your home pesticides and those you use on the farm. And these are all examples of what not to do. You want to have things stored neatly so you don't get a spill. You want to be able to read the pesticide labels. So if it does spill and it gets onto somebody, you know what they've been exposed to. And the one in the middle really is showing keep pesticides in the correct containers. Don't move them into unmarked containers. There's a number of cases where people have been poisoned because they brought home pesticides from work in maybe a 7-Eleven cup and somebody inadvertently drinks that, or a Dr. Pepper bottle. And also, what do you do with the empty containers? So recommending keeping things labeled, keeping them in a place where if spills occur, they're contained, and also keeping your containers locked up. I want to mention the Worker Protection Standard. This is a regulation required by the Environmental Protection Agency. The goal of the Worker Protection Standard is to reduce the risk of pesticide poisoning and injuries among workers and pesticide handlers. So it includes provisions for required training, talks about restricted entry intervals where you can't go in a field where pesticides have been sprayed for a while, what personal protective equipment is required, and then having decontamination supplies, and the fact that an employer needs to apply emergency medical assistance if somebody has been exposed. And I want to point out the burdens on the employers to provide the training. So a lot of this training can vary from one work site to another. In 2017, the Worker Protection Standard was revised, and the goal was to provide more protection for agricultural workers. So they said instead of training somebody every 5 years, it needs to be done annually. For the first time, they talked about reducing that take-home exposure pathway, which is getting family members exposed. Children under 18 are no longer allowed to handle pesticides. It kind of seems like a no-brainer, but in agriculture, a lot of rules are more lenient than in other workplaces. Respirator fit is another thing you may be asked about. If the chemical requires you to wear a respirator, you may need to go for fit testing, which includes a medical exam. One thing I want to point out about the worker protection standard is it's for workplaces. And many of our farms, in fact, over 90% of our farms in the United States are family farms. So family members are not considered workers. If it's a parent and a couple of children and a grandparent working on a farm, they don't count as employees. And so if you're fewer than 10 employees, you are exempt from following these regulations. So back to the hierarchy of controls. The last one here is PPE, personal protective equipment. You can see it's really important to make sure that the personal protective equipment fits the workers, that it's maintained properly. It does need to be cleaned. You can be exposed when you don and doff PPE. So having policies in the workplace is important. And then the last picture on the bottom is from a project in Egypt where we worked with them about what's reasonable as far as your workers. What can you do your job in these full protective equipment? And if not, then what else can we do to prevent exposure? So great resources are out there, a ton of them. The National Pesticide Information Center has great examples and case studies, well as statewide information, Migrant Clinicians Network, if you're working with farm worker communities, Poison Control Center, and then the Environmental Protection Agency. The book here, the EPA book is downloadable, or if you call them, they'll send you a copy. Here's the National Pesticide Information Center website. You can click on your state to learn more. And then finally, NIOSH, the National Institute for Occupational Safety and Health, has funded 11 centers of agricultural safety and health. They're all listed here. Each of those have great resources on hazards associated with agriculture. So in conclusion, pesticides are useful tools. They're not going away, but they can be very harmful to people. So we want to think about how we can protect people. There are many different types of pesticides and formulations. There are over 20,000 registered with the EPA. So understanding how people are exposed is going to be helpful in thinking how to prevent exposure and reducing risks from pesticide use.